I think it's the red.
I'm a newbie. They've thrown me into the wolves here. But good afternoon, Mr. Chairman and members of the board and Dr. Casey. My name is Angie Grant, and I serve as the chair of Chesterfield-Colonial Heights Social Services Board. And it is an honor to just greet you. On behalf of our board, we'd like to thank the Board of Supervisors for your support to Kiva and the Department of Social Services over the past year. We take great pride in the critical work of our Social Services Department and our role in providing administrative and policy oversight for a department that works with individuals, families, and our community to encourage self-sufficiency, preserve and restore families, and protect the well-being of children, senior citizens, and people with disabilities. We believe this is an incredibly important work on the behalf of our community. On our board, we have Mr. Engel, representing the Board of Supervisors. Thank you for your service.
Should I move down there?
Yeah, right. Come be with us. Representing Chesterfield, we have Juan Santacoloma. He serves as the first vice chair. Dr. Shauna Mayo, representing the second vice chair. Kathy Robbins and Jay Payne. And representing Colonial Heights is Chris Coleman, Betsy Luck, and Richard Yates. And I'd like for them to have a chance to stand up and just be recognized. Yay. Today we'd like to brief you on the past year, both successes and challenges, as well as opportunities that are in our future. And we've asked Kiva Rogers, and I think she's asked Danica Briggs to come and present this report to you. And Kiva has been the Director of Social Services since 2016 and leads the department with integrity, grit, and excellence. And she is a visionary leader, a heart for people, and a deep commitment to providing the best services possible with effectiveness and efficiency. And we are proud to call her our leader and director. Working alongside her are a few other great people, our Assistant Director, Danica Briggs, Eugene Walton, and Carrie Riley Jones. They are experienced, integrous, and I believe along with Kiva are the dream team for Chesterfield County. And in closing, this work, this team puts their hands to every day is hard work. The demands are great, the stress is great, and heartbreaking a good bit of the time, but again, important work for those in need. Both Chesterfield and Colonial Heights and our board is privileged to have a small part of this. Thank you for your time, and now I'm going to turn it over to Kiva and Danica to present.
Absolutely. I will say I am extremely glad that we did not go early in the meeting today, going after the J. Stegmeyer Fellow as well as the Everyday Excellence. I know my eyes were not dry. But again, Chair, members of the board, Dr. Casey, it is an honor to have an opportunity. This is my 7th presentation to you as the director of the Chesterfield-Colonial Heights Department of Social Services, and I continue to have butterflies in my stomach because I always want to make sure I'm doing a great job of sharing our story and maximizing this opportunity to really share the tremendous impact that our staff have had on the community over the year. We continue to be guided by the 4 strategic areas of focus that I've shared with you before. And like every presentation, I'll start with talking about our people, our workforce, who is the backbone of everything that we do as an organization. So this year is not going to be any different. When we entered FY23, we were faced with some familiar foes facing the workforce, whether it was increasing turnover, significant changes in about every program, every federal program that we administer underwent some policy changes that required us to regroup, learn new guidance and policies, as well as just, the loss of decades of institutional knowledge within our department. I can tell you that by the end of FY23, we had experienced a 28% reduction in separations from our department from the previous year. And right now, we carry the lowest vacancy rate that we've had since FY21. The department's strengths that were identified in a recent county engagement survey were our ability to having a safe and healthy work environment for our employees of all backgrounds, the quality of the work that's being done in our department, treating employees with respect and fairly, as well as promoting positive working relationship among work groups. Undoubtedly, those strengths have contributed to the increase in staff seeking promotions. Last year, we had 16 employees who were promoted, which was an increase from the previous year. We also celebrate our very first Family Services Specialist 2 position. We had our very first employee to complete the career development plan to become a Family Services Specialist 2. So we celebrated Eden Griffin in her completion. We also had 2 benefit program specialists who completed the career development plan in FY23. It's Anjanae Payne and Whitney Ford. So undoubtedly, those strengths, creating that work environment, contributed to those successes. Some areas of opportunity that were identified in the same study was our ability to manage performance in terms of onboarding, having a seamless onboarding experience and ongoing training. Communication across the board, making sure that we're getting information communicated to staff, as well as employee engagement. Recognizing those areas of opportunity, last fall, our department's entire leadership team, all levels of the organization, embarked on a journey together to complete a year-long, highly effective Human Services Manager training offered by the Human Services Leadership Institute. Models are designed to strengthen leadership practice and improve communication, ways that we can continue to create a high-performing work environment, as well as developing meaningful and intentional strategies to engage staff and maximize the skills that our team brings to the table. In addition to agency-wide leadership training, we've also, in January, became part of a group of human services departments in the county, given the opportunity to work with a national consultant on assessing the impact of secondary traumatic stress within our workforce. Led by a high priority of Dr. Casey to really look at how secondary traumatic stress impacts areas in the county outside of law enforcement and fire and EMS. Over the last 8 months, we've participated in a secondary traumatic stress breakthrough series collaborative that was launched in collaboration with the University of Kentucky, their Center of Trauma and Children. We currently have 2 DSS teams that have been on this journey with us. I wanted to highlight some of the changes that have already occurred as a result of our work in this space. We have an internal trauma-informed leadership team that has partnered with the county's employee assistance program and now provides monthly trainings to our staff to just help empower them and give them the tools to manage the stress of the job. They were very intentional about the offering of these trainings. Instead of offering it at lunch, which meant that staff would miss their lunch break, we have them in the morning or in the afternoon to make sure that we were embracing practices that were trauma-informed and recognize that the importance of staff having the opportunity to just kind of take a break from the day. We also have a wellness room that actually Angie's church, Clover Hill Church, has helped to establish for our staff. It's one that many county departments have come over to look at. We have reinvigorated interest in using the wellness room just to take a break from, staff who are dealing with folks who are experiencing trauma. Our staff have experienced trauma. We're working with, child fatalities and serious abuse situations, whether they're with seniors or with children. And so just recognizing that and respecting the importance of just taking a break during the day to regroup from some of the things that our staff hear. We had some umbrellas donated for our courtyard so that staff can now go outside and enjoy the outside. We created a garden club where our staff have planted vegetables and are sharing them and tending to them during their lunch break. So those are just some of the things that have been put in place as a result of our work with, again, national consultants that have helped to guide us and to recognize the importance of the work we do. So we definitely appreciate Dr. Casey making that a priority and giving us the opportunity to work with folks to address those things. One of the things that was clear from our secondary traumatic stress survey that we administered to our staff was the impact of stress across our department. So survey results revealed that, yes, we were aware of the impact of our child welfare staff and our adult protective services staff who, you know, like I said, are dealing with some pretty traumatic situations. We saw very clearly that our front desk staff were experiencing the impact of secondary traumatic stress because people oftentimes retell their story to them, and it really showed just, you know, the importance of equipping all of our staff with the tools that they need to manage the demands that customers are experiencing and presenting to them. One of the things that our customers are really challenged with right now is the end of the public health emergency, which was put in place in 2020 as a result of the pandemic. And so right now we're undergoing Medicaid unwinding. Every now and then I may call it unraveling. That just seems like a more appropriate word to me. But Medicaid unwinding, Medicaid is our largest program. And for the past 3 years, just to summarize the impact, for the last 3 years, we have not had to complete Medicaid renewals for a very good reason. We did not want to end Medicaid for individuals during the height of the pandemic. Well, those provisions ended on April 1st, and so now we are in the process of unwinding from those policy changes. For us, we're facing, working through over 24,000 Medicaid renewals that have been sitting dormant, are considered overdue as a result of the pandemic. Previously, before the pandemic, we averaged about 1,500 Medicaid renewals a month. Now we're over 2,500 Medicaid renewals a month, and so that's the impact for our staff. We have a year to work through the 24,000 renewals. Virginia was recognized recently in the Washington Post for their initiatives. They are leading the country and really being intentional about how we are doing this unwinding. Because for us, Medicaid recipients are, the majority are children, individuals with disabilities, and our seniors. And that population, we want to ensure that they do not lose their Medicaid. And so we have been working tirelessly to prepare before. When we knew it was coming, it was kind of like a false start. We're like, oh, nope, not this month, it's coming, but it has come. And I'm grateful that our staff have really prepared for the work that we have before us to complete over the next year. The department created a cross-divisional team, similar to what we did for Medicaid expansion, where we successfully implemented Medicaid expansion. For us, which was different than most jurisdictions, we didn't look at Medicaid expansion from just a social services perspective, but how could we support other areas in the county, such as fire and EMS, some individuals who we may have to write off their expenses could potentially be covered by Medicaid. But that's the kind of broad brush that we have looked at all of, that we're taking that same look at the public health emergency and the Medicaid unwinding. And so one of the things that we have done is just been very intentional about communicating. We attended a town hall meeting, making sure that we're trying to reach individuals who may not have updated their address, individuals who are homeless, working with our community partners who work with those populations, or individuals who are non-English speaking. Those folks are at higher risk of being negatively impacted by this. So we have been making intentional efforts to make sure that we mitigate that impact for our community. Another area that I wanted to highlight, in addition to the Medicaid program that's experiencing changes, is our child care program. You may remember last year we talked about, we launched a child care campaign. During the pandemic, resources were made available to clear our waiting lists, and so we did that and have maintained that since the pandemic. But we really wanted to educate providers, educate the community, see what we can do to help address workforce issues with child care providers. We have seen since that time that the number of eligible children receiving vital early childhood education through our child care subsidy program has increased 145% since FY19. Changes during the pandemic, such as the higher income threshold and the ability for children to get child care while their parents look for employment, has had a positive impact on kids getting into safe learning environments to, again, overcome some of the impact from the pandemic and being so socially isolated. To meet the demands of this program, our team has done a lot of reorganizing and strategizing. We have created a new structure for how we manage our child care services to families. And so we wanted to make sure that, that families did not get negatively impacted by the increase in volume, because it was an important thing for us to be able to extend services to eligible children. Many of the customers that were impacted by the PHE present to the department either by calling or visiting the department. And so we've made strategic efforts to improve the experience of customers when they come into our building. We receive over 89,000 calls into our switchboard each year. And so we have worked with the department IST to improve technology so that we can best manage our calls. We now are using technology in our lobby to help direct customers. We also created a lobby ambassador, someone who's in the lobby helping to find out why folks are there, helping to shorten the time that they're in the office, understanding why they are there, or directing them to other areas. We've also partnered with community partners such as the Equal Justice Works, who is in our department each month, providing assistance for individuals who are who are Spanish speaking, to help to make sure that they understand the changes that are occurring because of Medicaid unwinding. We've also worked with the Learning and Performance Center. Currently, we are working with the Learning and Performance Center to do a deep dive into our customer experience. They are starting from point A throughout their whole customer experience and are providing feedback to us on just different ways that we can improve the customer experience, given the significant shift in the workload that we are experiencing now. And so we're excited about the enhancements that are coming as a result of that. And I'm going to shift over to Danica, who was graciously voluntold by Dr. Casey. No, just kidding. But I'm going to shift to Danica, who's going to share some of the impact from a customer perspective for our services area.
Yes. So we really want to highlight two areas in our protective services programs where we're seeing sustained increases with customers who are accessing our services. So since fiscal year 2019, we've seen the need for adult protective services definitely have an upward trend. And so seniors, they were some of our most hardest hit during the pandemic for a variety of reasons. A lot of the day programs shut down. There was a lot more isolation. More of our seniors were being seen through telehealth visits, and now that they have resumed in-person doctor's visits, of course, there are more eyes who are able to see needs that were either unnoticed or may have been dormant. And so when we look at our interactions with our senior population, self-neglect is the highest substantiated type of maltreatment that our adult protective services team is dealing with. And this is a situation where the individual may neglect their hygiene, their feeding, or may not attend to their medical needs appropriately. And this increase in self-neglect, it has definitely been impacted by the rise in housing and food costs, as many of our seniors live on a fixed income. And so as these things have increased, they may have had to have chosen between, do I, take my medication, or do I pay my utility bill? So these are some really hard choices that they've had to face. And one of the really challenging parts of working with our senior population is that as long as the person has capacity, they have the ability to make these decisions and understand the impacts of the decisions that they're making, they may choose to continue in these neglectful behaviors, and there really isn't anything that we are able to do about that. And that can be a frustration with the community because they may notice some seniors who are experiencing self-neglect. They may contact us for assistance, and we go out and assess, and we offer resources. But again, as long as those individuals have capacity, all we are able to do is offer those resources, and they may still choose to remain in those situations. Now, if we get out there and we assess that they do lack capacity or there is some question about their capacity, we do work with them to get the proper evaluation so that they can be assessed. And if it is determined that they lack capacity, then we do go and utilize legal interventions to be able to act on their behalf. But we definitely anticipate that as the age wave continues to unfold, that the needs of our aging population will definitely continue to increase. Similar, we're seeing increases in our referrals for child abuse and neglect. And this has definitely been evident as children return to in-person learning full-time. It is predicted that these numbers are going to be higher than pre-pandemic levels for child abuse and neglect. Our primary sources for mandated reporters include our educators, followed by our law enforcement personnel, mental health, and medical professionals. And so we've really had to become very creative, and some of our leadership is here. Anjanette Gilbert is the supervisor for the Adult Protective Services team, and Kelly Mahoney as the Protective Services Program Manager. We've had to work together because while they're two very different populations, we're definitely seeing some trends in the needs between these populations where we're developing different responses, finding new collaborative partners, and looking at how we need to realign existing resources to improve our services with these populations.
All right, given Danica has shared, and we both have shared some critical services that we provide. For us, we believe that how we do our job and the work that we do how we do our work is as important as the work that we do. Pictured here is a group of our leadership team participating in a Lean 101 training that was provided with the Learning and Performance Center as well as Virginia Department of Social Services. We are dedicated and really committed to ensuring that we provide our leaders with the skills needed to examine every aspect of the work that we do to ensure that we are providing the most efficient and effective service delivery model to customers who are coming to us in a heightened state of need. It's important to recognize the outcome and the impact of what we have done. I would like to highlight some of the department's achievements over the last year. I just shared that the number of children receiving child care subsidy assistance rose by 65% last year and 145% since FY19. Despite those increases in demand, our child care team, led by Janice Stovall, who's with us today, Janice, if you can just raise your hand, her team achieved 100% timeliness every month during this fiscal year, and that is a tremendous compliment to the dedication and the hard work that team does to ensure that applications are processed timely and we get kids into child care as quickly as possible. The average timeliness for SNAP and TANF it was at 97%. In addition to the performance achievements, our department also received 2 NACO awards in collaboration with other county departments. One is for our work with the multidisciplinary team through the Child Advocacy Center, and the other is our work with County IST to create I'm going to mess up the IT name, so let me read it, a cloud-hosted case management system that replaced the system we had in place for our Children's Services Act. Again, trying to look at how we can leverage technology to best meet the growing and changing needs of the community that we serve. I'd like to highlight also the Ken Gap. This year, we successfully executed our first Ken Gap placement since 2020, when the pandemic began. The Ken Gap program is a program designed to improve permanency outcomes for children in foster care or at risk of foster care. This program allows us to approve relatives to receive the same financial assistance that an adoptive parent or a foster parent would receive and the child would no longer need to be in foster care. And so what Virginia was seeing was that kids were being adopted or staying in foster care far longer than they needed to, because the only barrier was the family's need for financial assistance. And so we have really promoted it and are very excited about, completed our first of what we know will be many moving forward. And Danika's going to share a little bit more about just the foster care program in general as it relates to our business.
Yes, so continuing with the permanency topic, we want to highlight some recent initiatives that have provided additional tools for youth in foster care. And these are several bills that Governor Youngkin signed that help support the efforts of our local staff in establishing permanency. And it, really aligns with the work, Natalie, that you're doing at the General Assembly, just helping to help our legislators understand these needs and the importance of these particular bills. So the first one is House Bill 1744, and this would allow home studies to be transferable across jurisdictions. Foster parents can be approved through local departments of social services or licensed child placing agencies. And we didn't want it to be a barrier of not being able to get a home study just based off of who completed that home study, because that was holding up some transfers of custody as well as some adoptions. So this bill actually allowed this process to become a little easier. And the reason that this is so important is that we want our youth in foster care to be in the most family-like setting. And so currently about 60% of our youth in foster care, they are in family-based placements, whether they're our local foster homes or our therapeutic foster homes. And the other reason is adoption accounted for over 41% of children who exited from our local foster care system. So again, these home studies were critically important in being able to achieve these outcomes. The next two House bills are to help improve outcomes for youth who age out of foster care. And they age out at 18 without achieving permanency through reunification, placement with relatives, or adoption. And research shows that these youth are at increased risk for homelessness, being unemployed, low educational attainment, early parenthood, or engaging in other high-risk behaviors that could lead to substance use or incarceration. And so in FY23, 34% of our children exited foster care without achieving permanency. To help reduce these barriers young adults may face because they don't have the natural supports that many of us may have had as we started into adulthood, House Bill 1402 requires Virginia's public colleges and universities to provide housing during scheduled breaks in the academic year. So when dorms shut down over winter break, many youth who've aged out of foster care, they may not have a family to go back to. They're able to stay in their dorms and housing support is available so that they are not homeless during that time period. And considering that 51% of Virginia's youth in foster care do not graduate by their 19th birthday, we want to remove any barriers that our college-bound youth may face. Similarly, House Bill 349, it provides housing support for youth who have aged out of foster care, and they've chosen not to continue services with our department through the Fostering Futures program. And so with this, even if they don't want case management, we've heard throughout the day that housing insecurity is a huge issue. It is definitely a big issue with our youth who age out of foster care. And so they can receive housing support for up to 6 months, either consecutively or non-consecutively from the ages of 18 to 21. So these are just a few ways that continued support is being provided. But we want to highlight one story, Julie's story. This year we had 4 high school graduates from our youth in foster care. Of those, we have one who graduated from Cosby who will be attending Virginia Tech. And so she'll definitely be able to benefit from the housing provisions that I just talked about with House Bill 1402 during her scheduled breaks. But the picture you see here is our annual graduation event that is hosted by Miss Angie Grant and Clover Hill Church and the Forgotten Initiative. And at this event, Julie had no natural supports who were at the event. She was allowed to invite supports to the event. She didn't have anyone to invite. So we showed up. Our local department staff, as well as staff from her independent living placement, were there. And throughout the night, Julie was just surprised when she would look and see people who showed up, and she would say, "You all came after hours just for me." And it was just really touching because when she was provided her graduation gift, there was just an outpour of emotion that Julie expressed. Julie, and I think all of us for that matter, Angie and Shanna who were present, was tearful when she said that she never thought that she would even graduate from high school. And she said that, to have people there celebrating her was just so important because, believe it or not, she didn't think she would even live to see the age of 18. And so, that was such an impactful moment for us, for our staff, because I think it's important for us to see just the impact that we truly do have on these children's lives when they are entrusted in our care. And as difficult as Julie's journey may have been with 2 episodes of foster care, first when she was an infant as a result of physical abuse, then she returned home to her family where she continued to endure a significant amount of family violence that resulted in a decline in her own mental health, a number of community-based services and residential treatment. And she came back as a teenager into foster care where she was continued to be in residential programs. But it was so important that she was able to celebrate one of the most memorable transitions to adulthood, and that's being a high school graduate. And because of our community of support, we were able to create an experience for her that we know that Julie will remember for a lifetime. Even though she struggled to feel seen, she was seen that evening, and we definitely wish Julie the very best. Throughout the presentation, we've talked about just the growing and diverse needs among our community and the efforts that have been made to build community partnerships and equip our partners with just the services and the benefits that we have at our disposal. And this is a picture here of our Assistant Director, Karen Riley. She was at an event with one of our Bright Point Community College, as well as one of our program managers, Latoya Cathcart. And it's been really important for us to be out in the community because not everyone is going to come to Lucy Core Circle for services. Not everyone is able to come to Lucy Core for services. So we really believe that it is important for us to get out into the community where our families and our shared customers most frequent. And so we are really pleased that we have an outreach specialist on our assessment and resource team who is out at 7 sites throughout the community. And we will be opening an 8th site in the southern part of the county at the Ettrick-Matoka Library later this in September. But we have sites at Virginia Career Works on Turner Road, several locations along the Hull Street corridor, including Manchester YMCA, Waymakers Foundation, Latinos in Virginia Empowerment Center, LaPrade Library. We've also partnered with Bellwood Elementary School, who is one of our communities and school sites, as well as the Colonial Heights Food Pantry. And one of the things that we are doing related to technology is, again, looking at ways that we can make information more accessible to our customers. And so we are working with IST to create an online request for services. So customers who need financial assistance or resources, they can complete a form online at their convenience. As it currently stands, they have to come into our office during business hours, or they have to call during business hours to request that assistance. And so we were able to successfully pilot this during COVID with one of our wastewater utility grants. And so we're really looking forward to how this will continue to enhance services. But again, as we've heard today, it is no question that housing insecurity is a huge need that is facing our community. And it's multi-layered. Many of our customers, they are employed, but the rising rent increases have just made it such that their current housing is no longer affordable. And again, as we mentioned with seniors who have very fixed incomes, the rising expenses have made it more challenging. And once you have an eviction on your record, you face even more barriers to securing housing. So it just becomes this continual cycle. And our assessment and resource team, they have become really our in-house subject matter experts on researching what is available in the community and looking at how we can collaborate. And so while funds for this, financial assistance, it can be quite limited, a lot of times it's really just taking the time to sit down with our customers, listening to their stories and helping them to understand some possibilities that they might not have realized even existed. On the screen, you're going to see, hot off the press, our new housing guide that is on our department's webpage. And we really wanted to, again, put information out on the web that citizens can access at any point, because it can be frustrating when you're in crisis. You have to wait to talk to somebody to be given a resource that we really could have had accessible some other way. So our hope is that those resources that we have gathered over time that we frequently provide to customers, we've put those on the website, making this information more accessible for them at their convenience. We also partner with agencies like Housing Families First and ACTS. And so this year, the Housing Families First Bringing Families Home program, they serve 20 Chesterfield families. And of those 20, 18 have been housed, and 2 of those families are still in that housing process. But what they're finding is the families that they're serving have much higher rent and utility arrears, sometimes up to 12 months of arrearages. Again, these things have to be cleared before they're able to move into a new residence. And so we're really pleased that this year, Housing Families First partnered with ACTS using the Chesterfield CDBG funding to be able to have a partnership where our agency can do a direct referral for families who are facing eviction. And we anticipate being able to assist up to 30 families with those funds. We do have a higher limit that we're able to assist with, so we may be able to assist up to $2,000 with assistance, which is far greater than the $350 that we're typically able to provide for rental assistance. And so we're really looking at ways that we can collaborate with our nonprofit partners. We've also really worked with other county departments like our community police officers, community enhancement, Chesterfield Mental Health, and our nonprofit partners like Homeward and the Daily Planet. Whenever situations arise, for instance, citizen concerns related to panhandling or encampments in the county, we've all come to the table, looked at how we can approach this from a uniform perspective, ensuring that those human services needs are being met. And this group was really integral in us creating housing insecurity resource cards that our police officers are able to hand out to individuals who are homeless with resources that may be able to help them with more long-term housing options. I just want to share John's story for just a second, because I think John's story really helps to show the complexity of the issues that our customers are facing, as well as the compassion that our staff really demonstrate on a daily basis. John was a 75-year-old male who had been homeless for over a year. His primary source of income was his SSI disability, and so when he received his check, he would get a motel room, and unfortunately, when that money ran out, John was back on the street. And so one day, John was observed outside of our agency by our custodian, and the agency had closed. And so the custodian came back in, notified staff, and said, there's a gentleman outside, sitting outside, and this was a couple of weeks ago when we were having this extreme heat. And so staff went outside, talked to John, realized that he had just been hospitalized, released from the hospital, and he took a medical taxi to the agency, only to get to the agency after we had closed. And so he was really concerned about his SNAP and Medicaid benefits because, as you heard earlier, we're in renewal processes, and if people are not responsive, they run that risk of those benefits ending. And so staff went out to talk to him, learn a little bit more about his situation. He was really hesitant about an emergency shelter because he'd had some negative experiences previously. And because of his age and his medical conditions, he fell under the scope of our adult services program. And so we were able to get a hotel room for him for that night and a taxi because we really needed time to assess what his needs were. And again, because it was after hours, we weren't able to get in touch with other community partners who had potentially served him. So we were able to put him in a hotel that night, but the very next day, he was rehospitalized. Because we were already involved, our adult services worker was able to collaborate with the hospital social worker to complete the necessary assessments, and we were also able to collaborate in-house with our benefits division to ensure that his SNAP and his Medicaid and long-term care benefits were in place. And John was able to transition from the hospital into a long-term care facility. It's just one example of just the holistic response that our staff provide. He came, benefits in mind. He left, and his chronic homelessness had been addressed by our staff. And again, this is just one of many countless examples that our staff interact with on a daily basis.
Danica shared some information about just the ways that we have responded to the shifting needs of housing insecurity. We do want to highlight our Housing Choice Voucher Program that we administer on behalf of Virginia Housing. And the Housing Choice Voucher Program is a federal program that assists 2.3 million Americans. Our program has undergone significant changes during this past fiscal year. We experienced almost 90% turnover due to, it's a small team that we administer. The supervisor retired. 2 of the 4 employees were promoted. 1 person was left, another person separated, and so we were under significant staffing challenges, program challenges, as well as the impact similar to Medicaid with a backlog of renewals. Despite those obstacles and barriers, this program recently received the highest performance rating of a high performer from a recent audit from the Virginia Housing Program. And so we commend our team that despite those challenges that they were able to rebound from those. A key to our success was Tanya Jeffries, who leads our housing program. Ms. Jeffrey is here. She came in right when we were approaching an audit, but her knowledge and skills and leadership allowed us to be able to effectively identify what we needed to do and to exceed expectations on the audit. I also like to commend Eugene Walton, who's our assistant director, who stepped in, learned the program, and led us. He's in the corner. He's probably more of an introvert than I am. No, he's not. I don't know what that's. I do want to, for the sake of time, I do want to highlight just a critical decision and partnership and collaboration that Jean led with the community enhancement team with Rich Billingsley. We were faced with over 300 inspections that needed to be completed to get us up to speed that had accumulated during the pandemic. And we partnered with Rich and the community enhancement team to complete inspections. And I am excited to report that as of May, I think it was 21st, wait a second, we eliminated the backlog of renewal of inspections. And that was because of just very strategic efforts on their part to really get us through that. The other thing we wanted to highlight was that we opened up the waiting list for the first time in decades. We were able to clear our waiting list, gave vouchers to 18 individuals off our waiting list. We were also able to give mental health 13 vouchers for individuals with intellectual disabilities. And so a lot of activity has been occurring in our Housing Choice Voucher Program that usually you guys are telling citizens the waiting list is closed. We now have a waiting list of about 100 people, and Ms. Jeffries has some connections with Virginia Housing, that she's really committed to moving folks off of the waiting list. When we went back and looked at our waiting list, we had people there from 1997. You hear that, Dr. Casey? And so just in closing, I wanted to just highlight our priorities. One is to eliminate the backlog of Medicaid cases. That is our priority for FY24. I would like to remind you that there was a time that we eliminated a Medicaid backlog from when there was a recession. We became the first level 3 department to eliminate the backlog, and I know that we're going to do that again this year. We've been meeting about it. We're going to meet that challenge. The other thing that we're focusing on is maximizing technology. We have embarked on updating our strategic plan in partnership for the first time with the Learning and Performance Center and County IST are at the table to ensure that technology advancements is maximized in every aspect of our strategic plan. And so we have just embarked on that work together and have had initial sessions. The other is to address, build on what we've talked about, which is the creation of the resource card, the community staffing model that we've created, the website. Those are just really initial steps into a bigger vision of really creating a model for how we respond to the community when facing housing insecurity, specifically coming up with creative solutions for seniors who are significantly impacted in that area. And the final, in closing, I'd like to just say that we are going to continue our work with the University of Kentucky. We have a team already positioned to be able to build on the work that we have already started. And so in closing, on behalf of the Social Services Board, the staff present in the room, I would just like for them to stand because I really got butterflies then, because I always want to make sure they do that I do a good job of presenting on their behalf. But I have a team of folks here who came to support us, and so if you could just stand really quickly.
Is there anybody you haven't introduced us to yet?
Yes. And there are even more back at the agency.
I didn't hear their names.
Oh, okay, I'll do that. Tanya Jeffrey, Housing Choice Voucher, Janice Stovall, and Jeanette Gilbert, our Adult Services Supervisor. Latoya Cathcart, who is our new Benefit Programs Manager. Eileen Fields, who really makes things happen in our executive team. Karen Riley-Jones, our Assistant Director for Admin and Finance. Stephen Hawley. It looks like we've got an adopted member. She's like turning her head. Yeah. Do you want to be a part? Shanna Brown, who's our new program manager for permanency. Kelly Mahoney, our CPS program manager, and Eugene Walton, our benefit programs assistant director. So everything that gets done is.
So who's running the shop if everybody's here?
Oh, we got the thing that we're working on is succession planning. So we can do this, and we've got folks back at the agency. But I really, on behalf of our staff and our board, just really want to thank the Board of Supervisors. I have to share that, you know, when I'm with my colleagues around the state, the relationship, the support, the leadership, the direction, encouragement that this board gives to our team is not something that other social services departments experience. And so I am just extremely grateful for you and all that you do for the county. Thank you, and I'm over.
Well, I saw a couple of board members writing, like Chris, I think you wrote a novel over here. Do you have any questions?
I'm always taking notes, as you know. But I want to say great work. I mean, obviously, with the economy doing what it's doing right now, people are experiencing lots of difficulty buying groceries, paying for gas, you name it, it's going up. There's no price of anything that's coming down. And so we opted, you know, as a country and the federal government to spend lots of money during COVID. Mm-hmm. And so I think we're all paying that collective price now. So all of the work that you are doing is critical, and right now is the time to do it. And of course, we're always pushed around with housing, Some folks don't want the county to grow, but we also know that we have lots of units that regionally we are missing. We have a gap of like 45,000 units. When you look at public transportation, we've made progress there. When you look at job training, and you all, one of the things I love about your department is you're looking at it 360 degrees to try to build that resilience, not just for today and serve that need right now, but looking 2, 3, 4, 5 steps down the road to make sure that the support is all the way through. And that to me is what sets you all apart from any other department in the whole Commonwealth. And I am deeply appreciative of the approach you've taken. Thank you.
Dr. Miller.
Mr. Chair, you only get an opportunity to make a first impression once. And you went ahead and just spoke about all the different things that you do. But one of the things that stuck with me was when the individual shows up and they are in the middle of this hurricane, that the individuals that they connect with have to be ready and able to meet them where they're at. And so it's so important that they get the kind of support necessary that they don't burn out. And so when it is after hours and someone's knocking on the door, that they're willing to take the next step. It's very easy to say, I'm done, I'm going home, I've had enough, saturation point, I'm finished. But instead saying, you know what, that well is still there, and we can show up and we can do it. So I'm appreciating you taking the steps for all of you to say, hey, we're going to make this first impression over and over again, and we're here, we're going to help, and a lot of that is taking care of ourselves. And so I'm just appreciating that you are using that part as an to initiate that, how important that is. So thank you for that.
Mr. Engel.
Well, first off, I felt like I was at a board meeting because we went through our people, our customer, our business, and our community, which we do in every board meeting. We talked about staffing, which we do in every board meeting. We actually go over every single separation and why they separated. And I noticed for a while we had a trend that we were having a lot of 5-year employee separation. And I'm very thankful to say that we've seen that trend of 5-year employee separation significantly reduced, and most of our separation are people that are within their first year to 2, which they may have gone into the right profession, they may not have, they may just not be the right fit for that seat, but maybe another seat. But we haven't seen when we've seen the loss now to the years of service, it's because of retirement more so than it is for the person leaving with a lot of years of experience outside of retirement. And I think it's a testimony to the board and to Kiva and your everybody involved in the leadership team that we do review why they're separating, and then we take actions to try to limit those separations in the future. And that doesn't happen in every organization. And to Mr. Winslow's point, it's refreshing to have an organization where many people view it as, well, we're just here to get somebody by, to help them through today. And this department has always been a department that wants to take wherever you find somebody, and even if you can't make them or help them to become self-sustaining, you make them better off than they were. And the goal of the department would be to work itself out of work. And I know that we will never be able to do that completely because there will always be people that aren't able to take care of themselves. But the goal is still to work yourselves out of work. And that is not a typical view in government in general, and especially for social services. So the way, what you said was Virginia was the leader. What you didn't say is that Virginia is emulating what Chesterfield does very often because of you and your leadership team that do such a great job of coming up with outside of the box ways to tackle the issues that you're faced with, and then this with the state not wanting to help and not wanting that to happen, and then figuring out, oh my gosh, this is working. What are y'all doing? Yeah. And they're coming to Chesterfield to figure out how to be the leader in the country. And you were very humble in not sharing that, but I could not let that go. So thank you.
Mr. Holland.
Mr. Chairman, thank you. First of all, I just want to thank each and every one of you for the outstanding work you've done. As the longest serving board member, I've seen your department over the years and heard many presentations. This is probably my 16th year of hearing this presentation. So I've seen where we've been, where we are, and I see where we're going with the outstanding leadership you exhibit. And I also would be remiss if I didn't share that I received a wonderful letter from a constituent who appreciated Ms. Gilbert's help in helping him with his wife. I know him personally because I've worked with him, but he also felt the need to email me and thank me for your department and for Ms. Gilbert's efforts in helping him with his spouse. And so I just want to give you a shout out for that and thank you for all the things you've done for me as well and the efforts I've had. But we appreciate all you do and the difference you make. It makes a tremendous difference. And two things I want to briefly highlight is I've talked to grandparents about child care in the area. That's an area hopefully we can work with the community to do well for the citizens, and always housing insecurities. I applaud that and anything we can do. And hopefully I'm thinking about our development community that can be a partner with us to help meet the needs that you seek to meet. So it's not simply a business proposition, but it's a service proposition. So I applaud you, and we appreciate all the great work you do. And we're always here to support you and to help you as you continue to expand your initiatives and your reach to serve and meet the needs of people in the everyday effort here in Chesterfield County. I know others will take note of that, as my colleagues stated, not only statewide, but even nationally. So thank you.
Thank you.
You all.
Well, I'm not sure I could say anything better than they did in any way, shape, or form. But, you know, in looking at the presentation that you just did and all of the different facets of what you do that are intertwined in the community, especially with those who are in need, you know, from my background, I know that these things are cumulative on how they actually affect an individual who's actually helping somebody. Each day you get another case, and each day it's, you know, a tearjerker like we had at the beginning of the meeting, right? And what I worry about, quite frankly, is, and I do this maybe too much, is our employees. And so I'm not sure if you have the program, but I know we started a program in the police department years ago, peer support. We have it in the fire department as well, and we have it in the sheriff's department as well. And I look at different parts of the county, and this is one of them, where there's critical services that are provided for the community every day that can be cumulative. And when my colleague talked about people leaving the service, we know that it's not just always about pay, right? And we know that you have a great work environment and they have great leadership, and you're all doing a lot of great stuff. But that doesn't change how sad some things can be and how they could affect people who work. And so I would hope if you ever need any support from us in a way of creating some type of peer program for your people to have, you would come forward with that request and let us see if we can help you in that manner, because life can be very stressful and it can be very depressing sometimes, and we want to make sure. Sometimes the people who are supposed to take care of other people, we forget to take care of ourselves. And we need to make sure we do that. So if you need any help with that, let us know.